Well, PH7 Dermatology is always looking for ways to help you find complete balance when it comes to your skincare. They're also very unique in one of their treatments. Here to share more about that and a little bit more about their office are Dr. Joshua Gapp and radio technician Josh Roark, along with Pam Davis, the physician's assistant. So we kind of have all of you here with us today. Thank you so much for joining us.
Thank you for having us.
Thanks for having us, yeah.
Well, Pam, let's start with you. Tell us a little bit about the clinic and what you guys offer.
Okay, we're a full-service dermatology office, which means we do all medical derm, and that includes any type of skin condition, skin disease, skin cancer, basic things like psoriasis, acne, the whole gamut of the skin. Anything to do with the skin, we do hair loss. We also do aesthetic and cosmetic procedures as well. So we have a full-time esthetician, and so, you know, we really are a full-service dermatology office.
And I'm sure you stay very busy.
We do.
One of the things that you guys are able to offer that really sets you apart is the specialized cancer treatment. Tell us a little bit about this.
So we have an image-guided superficial radiation therapy for non-melanoma skin cancer. So skin cancer is the most common type of cancer of all cancers, and the non-melanoma type is the most common of that. And so this technology allows us to, it's a non-surgical option to treat skin cancer. So like your basal cells and your squamous cell cancers, we now have an effective therapy to do it without a knife. So.
Without a knife, which I would imagine is really large news for this area to be able to do this and to do it with such great success. How are you involved playing a role in this?
So I deliver the actual treatments that are designed by our providers here. We typically give the treatments in a quick 15-minute session, you know, a couple times a week. The number of treatments depends on severity of disease. But yes, I actually deliver the treatments and am the face that they would see every day.
What kind of a response are you hearing from your patients when you're able to offer this in such a way?
It's overwhelmingly, I mean, a great response. And it's almost a year and a half that we've had it in the office now. And when it first started in the office, I mean, it was new to us at the time too. And we've had tremendous results with it. I mean, I couldn't be happier with the outcomes that we've been having. And you know, cancers before that would leave, you know, scarring or cosmetic defects or functional defects on patients. You know, despite our best surgical treatments for it, you know, they would still, you know, leave a scar on the nose, or, you know, take out a bit of the ear, or you know, in some way make the functionality of the patient, you know, worse than it was before. We've been able to completely eliminate that in most cases, and it's just, we've had tremendous results. I'm very happy with the therapy.
It's been great because you have very difficult areas that people will get a skin cancer on the face, especially
on your lips.
Yes, or the inner canthus, noses, obviously.
You know, right? Yeah.
Yeah, and so it's been a great treatment because the outcome is beautiful compared to what we've seen in the past.
Yeah, I was going to say, sometimes when people go in and they're doing that, they don't realize. And they, you know, they take a little bit more, and then they take a little bit more, and then they come out and they weren't prepared.
Yeah.
Sure.
So something like this, you're able to, I mean, I would imagine that's a game changer.
No, it really has been. I mean.
And it's ultrasound guided, so we can see at the beginning where the cancer is. You actually can see the depth of it. And then you also at the end see new tissue growth. And that to me has been phenomenal because the patient sees it with their very eyes that it's gone. This cancer is gone. There's not a guess, it's actually gone.
Wow. So what do people need to know if they're kind of in this situation right now, and you know, they've got that appointment coming up, you're able to do this? Are they able to come in, maybe get a consultation and find out what you can do?
Sure. We take most insurances, almost all the insurances, and so they come in, they do a consult, a medical visit like normal, and then if there's a biopsy needed, small piece of tissue would be used to get the pathology back. So you don't have to take a large piece, you just need to know what is this, and then they can get set up for the radiation. And
yeah, and for a patient who's already, you know, from somewhere else already had a biopsy and has a, you know, a proven skin cancer, if, you know, if they want, they can come in for a consultation with us and find out if they're available for this non-surgical treatment of it, and in most cases they will be. As long as it's a non-melanoma skin cancer, we can treat it. And there's there would be a size restriction. I mean, it does. We do need to catch it early enough to make it available for this, but I would say, well over 90% or 95% of the skin cancers that are out there we can treat with this. So,
Wow.
the non-melanoma skin cancers.
Very exciting.
Yeah.
It's great
Yeah,
stuff.
it is great
Well, thank
stuff.
you all so much for joining us. We're going to give
Thank you.
everybody the information on the office. If you would like more information, it's PH7 Dermatology, located right here in Johnson City. There is the phone number you can call. They also have a website, ph7derm.com, for more information. And again, thank you all for being here.
Thank you for having us.
The preceding portion of Daytime Tri-Cities was sponsored by PH7 Dermatology.